Good afternoon. Welcome to the third international webinar of 2021 organized by Vets and Clinics by Advance. I'm Alba Martos. I'm the International Vet Manager of Affinity. And today I'm very happy to be here with Albert Lloret. Good afternoon, Albert.
Good afternoon. Thank you, Alba. And thanks to Affinity for the invitation. Thank you.
Albert is working as a vet specialist in the feline internal medicine group in the vet hospital of the University of Barcelona. He's accredited by AVEPA and also by the Australian and New Zealand College. And he's also a member of the advisory feline group for Europe. And also he's a founding member of the feline group in AVEPA. So I'm quite sure that this session will be really helpful and really exciting for all of you. But well, before starting, I would like to remind you that during the session, you can write your questions, and at the end, Albert will answer all these questions. But in case we do not have enough time, here on the description, you can see in this page on YouTube, you will see an email direction where you can send all your questions, and Albert will answer all of them. And also here in the description, you can see a link where you can download the presentation of this session in case you want it. And I think that that's all. So I will not delay any longer, and we will start the session. Today, Albert will talk about the gastrointestinal problems in senior cats. And I think, Albert, that to start the session, we can talk about general issues about which is the history and the best physical exam that we can do in a senior cat.
Yes, thank you, Alba, for the introduction. Yes, we are going to give a serial of diagnostic clues using case examples on gastrointestinal diseases in senior cats. And first of all, let me to thank the place where I work, the Veterinary Teaching Hospital in Barcelona, and all the companies that help us to sponsor the residency and internship programs, including your company, Affinity. And yes, we are going to talk about senior cats, gastrointestinal problems in senior cats. In this graphic that you see here, recently published in the this year Feline Life Stage Guidelines, the American Association of Feline Practitioners consider that senior cats are all the cats older than 10 years old. And so we are going to focus on this group of cats. And of course, in general, in all cats, the history and the physical examination is essential, is mandatory. But in the senior cat, we must emphasize some of the, or in particular, some of the aspects, especially the appetite, changes in appetite and hydration, and vomiting, diarrhea, recent weight loss or even weight gain, signs like polyuria and polydipsia, which is very important, and of course body condition score and muscular condition score, which is also important and complementary with the body condition score. And we also know that in senior cats, it's very important, it's essential, all the changes in behavior and in habits and mobility that can let us think in important diseases, neurological diseases or cognitive dysfunction or internal diseases that can produce like increased nocturnal activity, nocturnal vocalization, and so this is a very general aspect of the history and physical examination in the senior cat, but it's very important. Also, the thyroid and kidney palpation, both are target organs in senior cats. Also, oral and eye examination, and of course, pain evaluation.
Thanks, Albert. So after having the history and the physical exam that we have to do in a senior cat, the next step we can talk maybe about which are the most typical clinical signs when we have gastrointestinal problems. What's your thoughts about that?
So we have this senior cat, and we are doing a complete history and clinical exam. And if we think, or our suspicion is that we are dealing a gastrointestinal case, we have to emphasize, or we have to focus on signs. This is very obvious, but signs like vomiting and diarrhea, changes in appetite, as I told before, anorexia or polyphagia, weight loss. But the key point here is that in many cats with gastrointestinal diseases, oftentimes they don't have specific gastrointestinal diseases. So sometimes vomiting and diarrhea are not present, and we only have a cat with less appetite or losing weight, what we call in feline medicine the ain't doing right cat. So it's not all the cats with gastrointestinal diseases have obvious gastrointestinal signs like vomiting and diarrhea. Of course, abdominal palpation is important because cancer or some forms of cancer are frequent in senior cats, so we have to feel, we have to palpate all the intestinal areas and the lymph nodes and the kidneys. So abdominal palpation is essential as well.
Thank you, Albert. So now, after having the idea about the history, the exam, and also the signs we can find in this kind of problems, can you share with us which are the most common causes of gastrointestinal problems, depending if the cat is younger or older? Can you explain us? Thank you.
This is the general list of gastrointestinal diseases. The big groups, what we call in internal medicine, when we do the problem-oriented approach system, is the big groups. So infectious and parasitic diseases, congenital diseases, obstruction by foreign bodies, food-related problems, either diet allergy or intolerance, rare primary motility problems, and then the metabolic, endocrine, what we call the gastrointestinal secondary problems, or inflammatory immune-mediated diseases or neoplastic diseases. Of course, this is the general list, and if we look at this list and we look at the different feline life stages, then the order of these diseases are different if we are facing a kitten with gastrointestinal diseases or a senior cat with gastrointestinal diseases. So taking into account the life stage, the age of the cat, and of course the history and the clinical examination is essential to put this list in an order from the most likely disease to the less likely disease. And for example, if we focus on the senior cat, we'll see that the three most common causes of gastrointestinal diseases in senior cat are the big group of metabolic endocrine diseases, so what we call the gastrointestinal secondary causes. The second group, the inflammatory immune-mediated diseases, including inflammatory bowel disease, pancreatitis, cholangitis, and and Exocrine pancreatic insufficiency. And then the third group, the cancer or neoplasias, neoplastic diseases, most frequent GI lymphoma, but of course other neoplasias in liver or other types of gastrointestinal tumors or in any other organ. Of course, we can see a foreign body in a senior cat. Of course, we can see an infectious or parasitic disease in a senior cat. We can see a food-related problem in a senior cat, but we should consider these three causes as rare causes, not impossible, but they are not very frequent in a senior cat. The last thing, and this is the way we work in internal medicine, when we face a case, a gastrointestinal case, when we work with the case, when we do our problem-oriented approach, we have to include in our mind, in our investigations, is that problem acute or chronic? Besides the gastrointestinal signs, we have other systemic signs. Is a severe condition or is a mild condition? So it's the cat in risk of dying, it's a life-threatening condition, or it's a mild or moderate condition, and we have time to do tests. So we have to integrate all these things to focus the clinical case, as we will see now in the case examples.
Thanks, Albert. So now we have a general picture about we can expect when we have gastrointestinal problems in cats. So I think that now we can start with practical examples. And the first one I would like to ask you is which relationship have endocrine problems with these gastrointestinal problems in cats?
Yeah. I will answer this question showing what we would think of a typical case of the most frequent endocrine disease in senior cats. And for example, we have this 10-year-old male indoor cat. It's a cat without the previous important history. He's vaccinated, dewormed, retrovirus negative. And in the last month, he's losing weight, so progressive weight loss. The owners think, when we answer, the owners think that, yes, the cat is drinking a little bit and peeing a little bit, so likely polydipsia, and he's definitely eating more, so polyphagia, and he's showing occasional vomiting. Otherwise, the cat is acting well and doing well. Maybe he's even more active than usual. So he's not a life-threatening condition at this moment. He's a stable cat. And of course, the first thing in a senior cat, we have to rule out the metabolic endocrine diseases that can cause these signs. So a urine test, a complete blood count, a biochemistry is essential. And if we look at the results, you have the results here, and I mark in red the abnormal results. You will see that the ALT is high, the alkaline phosphatase and GGT are high. Even the bilirubin is higher than normal. So if we see these results, we should think as a first sight in a liver or pancreatic disease. Now we know that all the liver enzymes are high, bilirubin is high, so in a senior cat, these abnormalities let us think to liver or pancreatic disease. But of course, not new. We know for many years that hyperthyroidism is a very frequent endocrine disease in all cats, the most frequent endocrine disease in all cats, and in this cat is essential and mandatory to check for T4 levels, and T4 levels were really high in this case. Abdominal ultrasound was normal. So in this case, hyperthyroidism was the cause of the gastrointestinal, of this vomiting, this polyphagia, and these elevations of liver enzymes. So the clue, and this is, as I say, this is obvious, and this is not new information. Hyperthyroidism is a frequent cause of gastrointestinal signs and liver blood test abnormalities. So we have to try not to get our attention to the liver or to the pancreas unless. So we have to check first for T4 levels. So this is what I would call a typical clinical presentation, a frequent presentation. Another type of case is related with hyperthyroidism. So we have in our mind that hyperthyroid cats are very thin cats, hyperactive cats, and the body condition score is very low. But of course, in the last years, we are testing for thyroid hormones in healthy senior cats or in senior cats with the minimal clinical signs. So look at this, another example, this overweight cat you have in the picture. But this cat this female cat is an overweight cat, but she has been losing loss in the last month because her weight was 9.5 kilos and now is 7.5, so still overweight. The appetite is normal, and we feel at palpation that thyroid glands are mildly enlarged, and T4 levels are higher than normal. So we also have the suspicion in overweight cats or even obese cats if they are losing weight. No? So the clue or the key point here, or the take-home message, is that hyperthyroidism in overweight cats is possible, is common, as long as we look for it routinely. So we have to check total T4 in all the senior cats, and if healthy or sick senior cats, we must check for total T4.
Thanks, Albert. So I think it's really interesting, this first case we have seen. So now we can move to the renal problems. And I don't know if you have an example about how a cat with gastrointestinal problems can have somehow relationship with renal problems.
The chronic kidney failure is the most the most frequent metabolic disease in senior cats. We know that the prevalences are extremely high. More than 50% of the cats older than 14 years, they get some degree of chronic kidney failure. So this is the most frequent disease in senior cats, and of course gastrointestinal signs, losing weight, vomiting, diarrhea, anorexia are very frequent signs. So most of the unstable chronic kidney disease cats come to the clinic with vomiting, with gastrointestinal signs. So the point here, or the example that I show, is to realize of another view of the situation. Look at this 14-year-old spayed female indoor Siamese cat, and she comes to the clinic with severe weight loss, still eating, but eating really few really little, occasional vomiting. And when we do the blood test, we classified her chronic kidney disease in stage 2 by the IRIS classification. So she's azotemic, but not really very azotemic, normotensive, borderline proteinuric. SDMA is higher than normal, but not really high. So the problem here and the key point here is a stage 2 CKD causing these clinical signs? And the answer is no, is most likely no, is most likely not, because we know, and that's the key point. I think that the IRIS staging classification is very useful, but it's not only an academic thing to do for academic purposes or for publication or for prognosis, but also to think practically about the cases, because we classify this cat in a stage 2, and we know that CKD stage 2 cats usually don't have clinical signs, or the clinical signs are mild. So there is no match, there is no correlation with the severe clinical signs and weight loss in this cat with the stage of CKD. So the point here, or the take-home message, is that in this cat we need to do more tests. So we don't have to stay with that the cat is sick because of the chronic renal failure, because stage 2 is does not correlate with a severe clinical disease. So, and in this cat, indeed, we did more tests, and we found pulmonary cancer. So this is a way that I would like to put this example to see how we use IRIS staging to face in a more practical way with clinical cases. So we always have to correlate the IRIS staging with the clinical signs.
Thanks, Albert. The next question we have, and well, sometimes we have this doubt, is we know that diets play a role in different diseases. So I don't know if you can share with us which is the role the diet plays in a gastrointestinal problem in a cat. So do you have any case or experience with that?
Yes, I will answer this question with another case example, and this is more a gastrointestinal primary disease. No? We have this 12-year-old spayed indoor female cat, vaccinated, dewormed, and this cat has been suffering from diarrhea over the last 8 months, so it's a chronic problem. We localize, by the clinical history, we localize the diarrhea in the small intestinal area. The cat, the body condition score is low, so the cat has been losing weight. The appetite is changing. Sometimes she's not eating, sometimes she's eating normal. And we see this case as a referral hospital, so many of the diagnostic work has been done before. Blood tests including renal, thyroid, hepatic, pancreatic, all the tests are normal. And not only the tests, but also, and it is common in these cases to do therapeutic trials with probiotics or with diets. And because this cat has been giving hypoallergenic prescription diets, gastrointestinal diets, several diet changes, and that's the place for diets in a chronic gastrointestinal case like this. When you are doing all the diagnostic workup, it's correct and you have to do to diet trials. So you have to change the diet and use hypoallergenic or gastrointestinal diets. And some cats, not this case, but some other cases, they respond to the diets because, of course, there are some cats with what we call as a syndrome feline chronic enteropathy, that they respond to the diet because they have an allergy, a true diet allergy, or a food response enteropathy. No? In this case, this cat didn't respond to the diet. The veterinarians also did a trial with prednisolone, and all the things, probiotics, prednisolone, in this case, the food trials produce or no improvements or transitory improvements. So when we see this cat with all this previous history, of course, we do a clinical exam, and we, in a case like this, two type of diagnostic tests which are very useful. One is abdominal ultrasound, and the other is what we call the GI function test, or test of gastrointestinal function, including the feline pancreatic lipase, FPL, as a test for pancreatic inflammation, the FPLI, so a test for exocrine pancreatic insufficiency, and the two vitamins, B12 and folate, vitamins that are giving us information about the functioning or physiology of the intestine, the absorption of these vitamins. And so we did this test, and here you have the abdominal ultrasound results in this cat. We saw disease in the jejunum wall, increased thickness, an important increase in thickness in the jejunum wall, especially in the muscular layer, and also jejunal lymphadenopathy. So this ultrasound result is giving us information that at least the problem is in mainly in the jejunum. In the other parts of the intestine and in other areas of the intestine, we don't see abnormalities. And we know that abdominal ultrasound. So nowadays we know that abdominal ultrasound is a very important diagnostic test in GI diseases. We can see the liver, the pancreatic, the lymph nodes, and good operators and good machines can let us see the intestine wall. But we know that these abnormalities are not so specific to discriminate between the two main diseases causing intestinal wall abnormalities, which are inflammatory bowel disease or small cell lymphoma. So this ultrasound is diagnostic of infiltrative disease in the intestinal wall, where we cannot diagnose at the cellular level. But abdominal ultrasound is very helpful to disease localization. For example, in a case like this, that we are seeing the lesions in the jejunum, in an area that we cannot get easily or we cannot get with the endoscope. In this case, the ultrasound can give us the information that is a better choice to do the biopsies, if you want to do biopsies by surgery, or what we call full thickness biopsies. The second type of test that we did was, as I told, is what we call the gastrointestinal function test. And in this case, the FPLI was normal, so there is no signs of pancreatic inflammation. Folate levels are normal, but B12, vitamin B12 or cobalamin is very low. And this is it's quite common to see hypocovalaminemia in gastrointestinal disease in cats. And this is something we have to be aware, we have to test, and we have to treat. Hypocovalaminemia can cause clinical signs like anorexia, diarrhea, weight loss. So in some cats, even when you start hypocobalamin supplementation, you can see a certain improvement in the clinical signs, and that's quite common. In some cats, even hypocovalaminemia and methylmalonic acidemia that can produce in result of the low vitamin 12 levels. We can see anemia and pancytopenia related with hypocovalaminemia, and even in rare cases, there are 2 or 3 cases documented in cats with neurological lesions. We have a case report accepted for publication in JAVMA. It will go it will be published in the next weeks or month, of a cat with a severe polyencephalomalacia associated to hypocovalaminemia. So it's something that we have to check and we have to treat. And the origin or the main causes, the causes of hypocovalaminemia are jejunum and ileum infiltrative disease, because in that distal small intestine areas are the places where B12 is absorbed, where the receptors, where there are the receptors for absorption, but also pancreatic disease, like either pancreatitis or insufficiency, hepatic disease, like cholangitis and lipidosis. Also, hyperthyroidism can cause a low degree of hypocovalaminemia, but in general, the hypocovalaminemia related to hyperthyroidism is not important clinically, and it resolves after the resolution of the hyperthyroid state. And when we always treat hypocovalaminemia before doing more invasive tests, so before anesthesia, before biopsies, we always treat hypocovalaminemia. Either we have 2 ways to treat, with a weekly injection. You have here the doses, but also today we have published information that oral supplementation, daily oral supplementation, can be helpful to restore the levels of B12. Sometimes, or rarely, but in some cases, when you test a cat with gastrointestinal signs for B12, looking for hypocovalaminemia, the results or the levels turn higher. So that is kind of unexpected. No, you are expecting, or you are checking for a low result, and the test comes back higher than normal. This is not really very common, but it happens. And for example, you see another case. This is not the same case, but you see a very quick example of a cat, 10-year-old cat with chronic vomiting and diarrhea, diagnosed time before of inflammatory bowel disease by biopsies, by pathology. And this cat is getting worse in the last weeks. And we check the GI function test for pancreatitis, and we check also for Exocrine pancreatic insufficiency, and FPL and FTLI were normal, but surprisingly the levels of B12 were higher than normal. And there are two publications about the origin, the causes of this hypercovalemia, and in most cases is related also to gastrointestinal inflammatory diseases, or even it can be a clue or it can raise our suspicion for some kind of tumors or cancer, especially liver cancer or lymphoma. In some cases can be idiopathic, so it can so we don't know the reason, but we don't find any kind of tumor. For example, in this cat, in who we found hypercovalemia, and I put here as an example, we even did a CT scan to abdominal CT scan and thorax CT scan to look for cancer, to look for tumor, and we didn't find a malignancy, we didn't find any sign of a tumor. So we associated to the chronic inflammatory disease, inflammatory bowel disease, these high levels of B12. So we back to the case that we are seeing. Remind this 12-year-old spayed indoor female with infiltrative disease in jejunum, in the abdominal ultrasound, and the hypocovalemia that we are treating. And we plan to do intestinal biopsies to discriminate between inflammatory bowel disease and or mainly between inflammatory bowel disease and diffuse lymphoma. We took the biopsies in this case by surgery because the disease is focused on the jejunum, and with these samples we send the samples to pathology, and also the pathologists did immunohistochemistry, and we know that also commercial labs and research labs can offer a technique called PAR, or what we call the lymphoma PCR in some cases, in some cases where the deep discrimination between the diseases is difficult. In this case, we didn't ask for the PAR technique because the pathologists were quite sure that the final diagnosis was a low-grade small T-cell lymphoma. All the cells were positive to CD3 receptor. So, and this disease, which is quite common in senior cats, we can even, it's a lymphoma and it's a cancer. It's a low-grade cancer that in general, in most cases, respond very well to quite simple treatment, prednisolone, initially higher doses, then gradual tapering, and chlorambucil, 2 milligrams per cat every other day or every other 2 days. And most of these cats, like this cat this cat I presented here, can have a good prognosis, and most of them live more than 2 or even 3 years.
Thanks, Albert. So I think that we have really useful information with that case. Just to finish a little bit this let's say this case, we have seen that it's quite difficult to differentiate between IBD and diffuse lymphoma. So can we finish this part just giving to the vets your recommendations about how to treat these both causes of gastrointestinal problems?
Yes, the discrimination between lymphoplasmacytic inflammation and a small cell low-grade lymphoma is sometimes difficult, and even the same samples, different pathologists can have different opinions. So there is a kind of subjective part in the diagnosis, and of course the these PAR techniques that many commercial labs offer now can help with the discrimination if the result of the PAR technique is that the sequence of this rearrangement receptor is monoclonal. It is more likely to be a lymphoma, and if it's polyclonal, it is more likely to be inflammation. So, but as you will see now, my opinion is that we are in the beginning. Even many experts and very good clinicians consider PAR a kind of gold standard for the diagnosis. I think we are still in the beginning, or maybe it depends on the lab. Maybe we have labs making PAR more sensitive or less sensitive, more specific or less specific, and also in intestinal pathology there is a kind of debate or kind of dilemma till a certain point. What is normal or abnormal, and what's the age influence? And to illustrate this debate or these questions, in 2019, this really interesting study was published. This study is results of histopathology, immunohistochemistry, and molecular clonality testing, so the PAR technique, of small intestinal biopsy specimens from clinically healthy client-owned cats. So in pathologies, when pathologists diagnose intestinal biopsies, the reference is studies that has been done many years ago with SPF kittens. So the normal intestinal wall is compared with the intestinal wall of kittens, SPF kittens. So it's an experimental model. So in this study, I think it's a very smart study because they included in the study 23 healthy cats going to anesthesia for dental cleaning. But these cats were senior cats around 9-20 years old. And they, while the cat was anesthetized, they took samples, endoscopic samples of the stomach and duodenum and ileum. So they do biopsies of different areas of the gastrointestinal tract. And when the pathology look at these samples, in most cases, in most samples, they diagnose lymphoplasmocytic inflammatory bowel disease. So they consider that there was inflammation. And remember that this is a study from healthy cats. In 2 samples even, by pathology, they diagnose small cell lymphoma. They also did immunohistochemistry, and the cells were T cells. So in feline intestinal wall, the T cells, the lymphocytes are predominantly are the most frequent cell. But when they did the clonality testing, so the PAR technique, it came back as polyclonal in 6 of the samples, monoclonal in 8 of the samples, and mixed polyclonal, monoclonal in 5 samples. So the final results of this study, taking both pathology and PAR, is that you can diagnose small cell lymphoma in 13 cats, in 13 healthy cats going to anesthesia for dental cleaning, and IBD, inflammatory bowel disease, in 6 cats. And after and then they follow the outcome of these cats, and only 3 of these cats developed gastrointestinal signs over the next 2 years. So this question raises a lot of, this study raised a lot of questions about what's the frequency of the subclinical disease of senior cats, or the BASAVA pathology criteria of what is normal and abnormal in the intestinal wall in senior cats should be adapted to age, and also how specific is PAR. So maybe the PAR is a very specific technique when we do in samples where, or in sick cats with clinical signs that we have a high clinical suspicion of disease, but maybe it's not so specific if we are doing in every cat that we took biopsy samples. So this is an interesting study and quite disturbing studies at some point.
Thanks, Albert. It's more clear, I think, now. So let's move to the another issue. I think that now we can talk about pancreatitis related with gastrointestinal clinical signs. So, which is your experience with that? Can give us some advice?
Yes, pancreatitis in cats is a common disease, and especially in senior cats, also in mature adult cats, but especially in senior cats. And sometimes pancreatitis, we know for many years now that it's related to other diseases like cholangitis, even related with inflammatory bowel disease. It's well known in cats that sometimes we diagnose what we call triaditis, which is the confluence of pancreatitis, cholangitis, and inflammatory bowel disease in the duodenum. And so, and 20 or 30 years ago, we were not able to diagnose pancreatitis in cats, only in the necropsy. But in the last decades, there has been a lot of improvements, and now we can diagnose pancreatitis taking into consideration the clinical signs, the history, the clinical signs, the abdominal ultrasound, and also specific markers, as I told before, like the feline pancreatic lipase, which is not 100% sensitive and 100% specific, but it's a very good test taking into account with the other tests. So as usual, internal medicine is that there are no magic tests. It's a combination of different things. So we have here this case example, a 12-year-old spayed indoor female is a diabetic cat. Diabetes was diagnosed 2 years ago. 1 year ago, it was diagnosed of cholangitis and pancreatitis with ultrasound and the blood test abnormalities. And this cat is having a wax and waning clinical picture. Sometimes she's fine, and sometimes she's not feeling well, he's not doing right, with some vomiting. But bottom line, she's doing quite fine. You can see that she's overweight, or she's even obese. But she's now in one of these moments that she doesn't feel very well, with some vomiting, and the diabetes is stable, controlled. You can see the levels of fructosamine, but the FPLI, the pancreatic lipase, is higher than normal, is 8.6. Vitamin 12, B12 levels are normal, and in the abdominal ultrasound we see moderately enlarged pancreas with inflammatory changes. So in this cat we can diagnose pancreatitis. And pancreatitis in cats is a disease that there are some types or some different presentations of feline pancreatitis, from the most severe life-threatening presentation, acute necrotizing pancreatitis, which has a very high mortality, to the acute suppurative, which is neutrophilic inflammation in younger cats or mature adult cats, that in general with supportive treatment it can have a good prognosis in most of the cats. But also we see the chronic forms. The classification is not really definitive in feline pancreatitis. There is a lot still to investigate and to look for in feline pancreatitis. But we see some senior cats with these chronic forms of pancreatitis, in which the inflammation is more chronic, lymphocytic, plasmacytic, sometimes associated to cholangitis and inflammatory bowel disease, what we call triaditis, and it's in the ultrasound we can see sometimes this nodular pattern in the parenchyma, in the pancreatic parenchyma, associated to fibrosis, and the pancreatic lipase can be normal if there is no an acute bout of inflammation or high if the cat is suffering like an acute bout of inflammation. So in this case, the situation we have at this moment is that our suspicion is that this cat is suffering from an acute pancreatitis, not really not life-threatening because the clinical signs are not severe, but also in this case what I want to introduce is that in these diabetic cats with chronic pancreatitis, we have to check. We always have to check also for pancreatic insufficiency. So in this case, we also asked the commercial lab to do a feline TLI, which were normal in this case. So this 25.3 of TLI was normal. But this is important because one of the consequences, one of the complications that we can see in cats associated to chronic pancreatitis is the pancreatic insufficiency, what we call the feline exocrine pancreatic insufficiency, which is a disease that we can say that is an emerging disease, not in the sense of an infectious disease, but in the sense that years ago we didn't diagnose cases, or it was very rare to diagnose EPI, exocrine pancreatic insufficiency. But now, since we have a good test and we know how to suspect of this disease in cats, we are diagnosing more cases. The clinical presentation is completely different to dogs. We see API in young dogs with pancreatic atrophy, and on the contrary, in cats, we have to suspect of EPI in mature adult senior cats with weight loss, especially with soft feces, not really a watery diarrhea, and poor haircut, and cats suffering from episodes of anorexia and combined with episodes of polyphagia. And more rarely, more unfrequently, we can see more typical watery diarrhea. It can also can be associated to vomiting because this disease in cats is associated to chronic pancreatitis, is associated to diabetes mellitus and hepatic, and also liver problems like hepatic lipidosis. It's also a frequent cause of hypocovalemia, as it was shown in this retrospective study of 150 cases in cats and from the US. And this is a disease, a complication that we can treat with pancreatic enzymes and supplementation of B12, but some cats do not respond to treatment, which is quite logical because this problem is a complication of a chronic pancreatitis. So it makes sense that a small percentage of cats do not respond to treatment.
Thanks, Albert. Let's move now to the last part of this session. So for the last question, I would like to ask you, because we know that infectious diseases normally are associated with kittens more than with senior cats. But I would like that you share with us maybe some cases related with infectious diseases and senior cats too.
Yeah, and as I told in the introduction, in gastrointestinal cases, we have always to suspect of all the different possibilities. No, we know that the IBD, the pancreatic, liver problems, cancer can be the most frequent cause of disease in senior cats. But we never, in internal medicine, we never forget all we never miss, we never abandon the other options. It depends on the clinical presentation. And of course, if we are seeing a senior cat with a clinical presentation that make us think in an infectious disease, we won't rule out infectious disease just because the cat is a senior cat. For example, the example I choose for this presentation is this 11-year-old spayed female indoor cat, a 100% indoor cat. This is important in the clinical history. This cat was vaccinated against herpes virus, calicivirus, panleukopenia when she was 8 and 11 weeks old, and she never get more vaccines, and she has been always living in a flat with no contact with other cats. And she was a healthy cat, and all of the sudden, so it is a very acute case. It's not a chronic, walks and waning case. It's an acute. The cat was healthy, and in all of the sudden, she got sick with acute anorexia, depression, vomiting, dehydration, fever, moderate abdominal pain. This clinical picture could let us think in an acute pancreatitis, for example, or in a septic peritonitis. And when we did blood tests, we saw a severe leukopenia, so the white blood cells were really low, especially the neutrophils were really, really low, so a severe neutropenia. Biochemistry was normal, and in the abdominal ultrasound, we don't see liver, pancreatic abnormalities, and what we see is intestinal mucosa in some areas of the intestinal wall, thinner than normal, and with hyperechogenicity in the mucosa. So it's abnormalities suggesting an acute process, so an acute gastroenteritis. And in cats, if we see an acute gastroenteritis with severe neutropenia, the most likely disease is parvovirus infection or panleukopenia. And we did a CPV, a fecal antigen test, a parvovirus fecal antigen test in this cat feces, and was positive, and we confirmed the results by PCR. So this 11-year-old spayed female indoor cat living 100% indoor conditions and with no contact with other cats got panleukopenia. And the reason this cat got panleukopenia is because his vaccination schedule was not correct. It was not correct at the beginning, and she was never revaccinated or boosted again. And we know that panleukopenia, parvovirus, is a quite resistant virus in the environment. So probably one of the owners or one of the visits got virus into the house, into the home, and the cat had no memory, had no a good memory immune response, so he got sick of panleukopenia, living in an environment in which it's not logical to get panleukopenia, you know. And years ago, this publication was published in Germany, in the area of Munich, and it's a retrospective study of more than 200 cats with panleukopenia, and they saw that they saw not really a great number, but they saw senior cats 12-year-old, 14-year-old with panleukopenia, cats with a not proper, not correct vaccination schedule, and almost 20% of the cats were 100% indoor cats. So the two key points here. One is that senior cats can get infectious diseases, of course, and the second key point is that in a disease, in an infection like feline panleukopenia, having the vaccination updated and a correct vaccination protocol is mandatory for prevention.
Many thanks, Albert. We have arrived to the end of the session. So we have been receiving some questions in our chat. So, well, keep connected and we will come back in a few minutes to answer your questions. Thanks very much.
Thanks to you. Thanks so much for the attention. A pleasure.
Okay, Albert, we have several questions, so we will start with the first one. If we have a cat, hyperthyroid cat with gastrointestinal signs, is it possible that this cat has another disease at the same time, or what's your experience with that?
Of course, all the ones working with cats, we know that senior cats are really specialists in having more than one disease at the same time. So they are frequently poly diseases patients. And we see cats with hyperthyroidism and chronic kidney disease, or hyperthyroidism and inflammatory bowel disease. So again, it's a matter of the clinical approach. And of course, if we are seeing a cat with gastrointestinal clinical signs, and we find that the cat is hyperthyroid, we have to treat the cat, but it depends on the clinical exam and the blood test. We will consider to do an abdominal ultrasound as well, as I did in the cat that I presented, to see if there is anything else. Sometimes we find intestinal lesions, sometimes we can find pancreatic lesions, and this is important because then it comes the expectation of the response of the treatment. If the cat is hyperthyroid only, the outcome of the expectation for the response of the treatment will be very good. And otherwise, if the cat has another diseases, we will have to treat both diseases. No? Another important aspect in this question is that we know that non-thyroid diseases, so the other diseases, can have the tendency to lower the thyroid levels. So sometimes a cat is really hyperthyroid, but the T4 levels are within the normal range, in the high range, but the thyroid levels are in the normal range because the other disease makes the thyroid levels go down. That's what we call the euthyroid sick syndrome. No? So in some cases, when we have cats with several diseases at the same time, even the diagnosis can be difficult because there are interactions between both diseases or all the diseases, and also the expectation of what we can expect of the treatment response can be affected. So yes, so that we tend to test as many, of course, always within a logical common sense, that we tend to test senior cats or sick senior cats and to check for all the likely diseases that the cat can be suffering.
Okay, many thanks, Albert. The second question is that, well, if you could discuss your opinion about the best technique for intestinal biopsies, when to do endoscopy or surgery?
Yeah, that's a very important question, and a lot of publications and debates about that, and also personal preferences between clinicians and experts. In general, as we review the information that has been published in the last years, what the bottom line, we could say that if we see the typical ultrasound abnormality, that the muscular layer is thicker, but we don't see abnormalities in the mucosa and submucosa, we can take biopsies by endoscopy, and we will find the lesion. So it was published years ago, because we were always afraid that if the lesion was in the muscular layer, with the endoscopic biopsies, we were not able to get so deep to get the lesion. So that's one thing it has been demonstrated or published. The other point is that, as I told in the case, is the localization of the disease. So by endoscopy, we can get the duodenum, of course the stomach, duodenum, and by colonoscopy, we can get to the colon, and also getting through the ileocecal valve to the ileum. But we cannot get biopsies of the jejunum. And in most cats, the inflammatory or the infiltrative lesion is in the jejunum. So in these cases, the surgical biopsies are needed, because it's the only way to get biopsies from this long area of the small intestine. These are, of course, there's some clinicians that they prefer to do surgical biopsies because they don't have experience with endoscopy. They don't want to refer the case, so this is good. This is okay. And some other veterinarians are very well trained with endoscopy, and they can take beautiful and nice biopsies from the areas where you can get with the endoscope. So again, again, as a bottom line, it's a clinical decision. It's several factors getting into the line to get the final decision. Your personal experience, where you see the lesion. So there's several actors playing a role in the decision.
Okay, thanks. I think that it's understood now. And we move to the last question, Albert. The last one is, how do you treat chronic pancreatitis? Which is your advice?
Yeah, we don't know. We don't have. We don't know. We don't have prospective clinical studies. We don't know what's the best treatment for chronic pancreatitis. Of course, support. We know the supportive treatment for pancreatitis, acute and chronic. If the cat is vomiting, antiemetics like maropitant. If the cat is suffering pain, analgesics. If the cat is in an acute episode and is dehydrated and he's in a severe condition, we need to hospitalize. But for the chronic lesion, for the cat with a chronic pancreatitis, with recurrent gastrointestinal signs, but the cat is not in a severe condition, we don't know the influence of diet. We don't know, probably because some of these cats, maybe they have also inflammatory bowel disease or they have cholangitis. We use gastrointestinal diets, or we do a food trial with hypoallergenic diet. So this something we do in clinics, but we don't know what's really the beneficial effect. And also the big question is, like in other chronic inflammatory diseases with predominantly lymphoplasmacytic inflammation, is the use of corticosteroids like prednisolone, like we do in a inflammatory bowel disease or a lymphocytic cholangitis. And it makes sense to test or to try to do a corticosteroid trial in a cat with a chronic pancreatitis, but again, we don't have evidence in favor or against. So we don't. So the question is that we don't know. But I personally have treated some cats with corticosteroids, with prednisolone, with the same type of scheme that we do in IBD or chronic cholangitis. And in some cats, you see the benefits, and in some other cats, you don't see benefits. Probably the problem is also that the final diagnosis of chronic pancreatitis is difficult, because you would need a biopsy, and we don't do many pancreatic biopsies.
Thanks, Albert. So we do not have more time, so we are at the end of the session. Thanks for being here today with us, and thanks our audience to be here. And well, we hope that we have enjoyed this webinar, and we will wait for you next month with the new webinar. Thanks very much.